Welcome to Getting Better with Dr. Adam. Dr. Adam Silberstein is a clinical psychologist who has been working in the field since 1993. With a broad range of clinical experience, including state psychiatric hospitals, adolescent residential treatment with a trauma focus, the Department of Corrections, and in the addiction treatment arena. Adam is currently in private practice and serves as a clinical consultant and supervisor for a number of treatment centers. This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.
I just met with Jared Anderson and Lindsey Boone from Sunstone Recovery in Bend, Oregon. For those of you who don't know, the bread and butter of any treatment program is groups. And I don't think I have ever encountered such a thoughtful duo in terms of the mission of how you deliver group. Lindsey is the CEO and founder of Sunstone Recovery in Bend, Oregon. It's an intensive outpatient program, but what really struck me was not only the deliberate and very, very effective, focused manner of group, but what's interesting in this is how they converted that mission of helping people grow and develop in the capacity of a group into the land of virtual therapy. And, they're both super excited about what they do and how they create that atmosphere that helps people change and get better. So with that, I hope you enjoy that talk I had with them. Thanks so much. Hi, everybody.
Hey.
Hi.
Hi, I'm Adam Silberstein, and you're here on Getting Better with Dr. Adam. And today is November 30th, 2020. And before we begin, I saved this for you, and I thought, hell with it, I'll just say it. November 30th is my sobriety anniversary. And I have the gift of having my esteemed colleagues on with me, Lindsey Boone, who I had the pleasure of mentoring early on in her career, and now she is the founder, and I am a contributor as well, but she is the founder and operator of Sunstone Recovery in Bend, Oregon. And she has with her wingman, her collaborator who has so helped establish and set the tone together of this great mission in Sunstone Recovery, Jared Anderson. And I'm just honored to have both of you on this great day for me. So
thanks, Adam. And I want to say happy anniversary. Yeah. I'm so happy to be here on your anniversary.
So for those who are listening, that's a big deal. And at this stage of the game, rather than making it about how great I am, I would much rather make it about how I can be helpful. So I want to give a little bit of background. I said earlier I'm a contributor and a consultant for Sunstone Recovery. And I had the pleasure of actually going out there and meeting with the team back in August of 2020. And, as people know, I'm a clinical psychologist. I do a lot of work both in private practice and in the treatment center space. And one of the primary methods of service delivery that has probably the most benefit in many ways is group therapy. And that's cool. If you go across the country and you see various centers at any time right now throughout the United States, there are thousands of groups being conducted. That's just the bread and butter of treatment. And what was interesting for me, at least as a provider, is all of a sudden, here comes pandemic and here comes Zoom. So it just doing work in a telehealth manner especially when it's a group, is so. I had to make adjustments, and I've done group with 40 Bloods and Crips in one room. So I've been in weird group situations, and this one was a real curveball for me. And I just want to say I came out there to hear about how Sunstone, how Lindsey and Jared are setting the tone for treatment, and it just it blew me away. So I thought I gotta share this with people and help them share their message. So welcome again. And if you could tell me, I think it would be helpful. Tell me a little bit about Sunstone Recovery and how you view group therapy and what it means to you both.
Yeah, maybe I'll start, Jared, and then pass it to you. So, I've worked in the treatment field for over 10 years. And I think my experience previously of group has sometimes been a necessity to kind of, as part of treatment, it's a necessity, but maybe not always seen as valuable, maybe more filling time. And so I think one of the things that came with opening this facility was, if we're going to have people be in group, it has to be valuable. Every group has to matter. And so one of the things that having Jared on the team has been a real blessing, because he is like a savant at group therapy.
That's a compliment, by the way, Jared. Savant could imply that somebody does one repetitive motion, and that's all what they're all about.
I think that's an idiot. That's an idiot savant. Right?
Yes,
is the one.
Right?
Yes, I think she meant that you're so skilled at this one thing, it blew her away.
Yeah, I know her.
Yeah,
I know
she has the other skills, but this is something. So what he brought, I think, to Sunstone is my desire to have groups be really, really effective and matter. He actually was able to bring, how do we practically achieve that? And so maybe I'll let Jared kind of speak to, so I basically in my career, I've run countless groups. The way that we do them here is different than I've done in another facility that I own. Very, very different. And I really credit that to Jared's spirit and his approach.
So Jared, I'm going to pass this to you, but I want to tell me a little bit about you. And I hear Lindsey saying business as usual, at least in the places she was at, didn't speak to her in a way that gave the depth and meaning she wanted to help people. And when we say help people, we're talking, just for people who are listening, we're talking about people who need what's called the higher level of care, people who have, once a week therapy isn't going to cut it, and they're advanced in their addiction or mental health issues, so much so that they need a lot of involved treatment. So she finds Jared, who has this background in group. Tell us a little bit about your background with group and what you bring to the table here.
And maybe Jared, before you do that, I just want to make sure, I don't think it was clear. I was actually criticizing my own personal approach to how I used to do group, or when I operated in another facility, how we did groups there as opposed to like other facilities. I want to make sure I was speaking about my approach and that we do it here differently and that matters. But I was really speaking about myself. So go ahead, Jared.
Right. And there's a lot that you said, Lindsey, too, that feels good. And maybe I'll get to later. But you were asking, Adam, my background. I say my relevant background. I went through treatment as an adolescent, so I had a lot of groups, and like how you said, Lindsey, I had a lot of boring ass groups, like where you're sitting through people just sort of regurgitating information that the counselor wants to hear, or that would make you a good client. And so there was that, and I definitely worked in the field and ran a lot of groups in my day, kind of in that vein. But where I feel like the relevance here for our groups and the skillfulness that we're bringing comes from my practice community, which a lot of it, because we're from all over the world and we'll meet in a centralized location but then go away, we'll practice online. And so a lot of my group practice capacity comes from working with people, with my own personal process, with other people's process, in that fashion. And then this, I think, interests you, Adam, as per our conversation the other week. I've worked with young adults, and kind of adolescents, and I've had to run a quote unquote mindfulness group for years. at multiple facilities, but mainly this one. And trying to get attention is like it's like herding cats, but you can do it. I think you just need a lot of hours of practice or some good guidance. So that's kind of some of my background.
So I heard this concept of practice community, right?
Yeah.
Lindsey and I have been in the field for a long time. I don't think she would ever, we never, a practice community just around the art of group and the method of group delivery is super cool. When you say practice community, what do you mean by that? What does that look like for you?
Well, so it's a specific community, and the way it looks is that we practice integrating our own shadow material. We practice deepening our own meditation, and we also practice kind of the art, for the lack of putting it eloquently, the art of being triggered by other people and learning how to stay with that process and not having it hurt.
Okay.
Having it rather feel and deep.
The art of being triggered by other people, learning how to stay in the process and not and walking through the wounds of that experience, right? Walking through that and coping with it. So I think that, and that's very interesting. And I want to know, how does that translate to a day in the life of Sunstone? You know, what does it look like with bringing that practice community element in terms, and also integrating with Lindsey Boone, who so desperately wanted to bring something that packed a lot of heat? What does a day in the life of groups look like?
So do you want?
Yeah, go for it.
Well, one of the things. So what's interesting, Lindsey just complimented me at the beginning, and I think a lot, in large part, Jared brings this, and this is why. What's interesting, what I can take credit for is this, and this is from my community, is creating space to include more of what was and what is present. And one of the interesting things with Lindsey is her capacity as a practitioner. And can I say one thing, Lindsey?
Good.
Lindsey was like, it's funny. It's like, she is the most, or one of the most skilled therapists. She renewed my faith in therapists because she owns this capacity, and she was very resistant to bringing her group facilitation capacity. And the more we included her capacity in group, the more it could shine and become this element of health and generosity, and lacking the words. But so the day in the life of group at Sunstone is mainly our motivation to include and to create space for what's coming into the group, so that we don't have to kind of exclude. And I think people in early recovery have come from family systems, whether present in their life now or in their childhood, where there was a lot of exclusion of especially parts of themselves that couldn't show up. And so we're kind of slow in forming a base. We begin each group with a 3-part check-in, which is tuning in with the physical body, the emotional body, and then the mental landscape.
Can we do that for a second? So
yeah.
So you start each group, and before you set the tone with checking in, right? So what would that look like? I'm new. It's my first day.
Yeah.
What does that look like?
Well, one of the things too, Jared, if I can jump in, is if you're new, like we're so attentive to, we try and be so attentive to someone's process. And so one of the things is, if someone's new, we even go deeper into the process. So we want people to feel included and a part of, so they don't just come into their first group and they're just like, good luck. We have this whole process of even introducing them to this thing that we do at the beginning of every group, which is this 3-part check-in. So they get educated and informed about why we're doing it, how we do it. They get to practice it, right? We let other group members teach them, so that hopefully during every part of the process, it's about landing and grounding. And one of the main things that we focus on too is what we call here like nervous system regulation. So when we used to meet in person, from like every time someone walks into the office, the pillow even is in the exact same spot. Like everything is attending to, let's regulate, they know what to expect. And so we start the group with group guidelines is actually the first thing that we do. We read them every group and so that way people land, they know what to expect, really similar to kind of an AA when you read chapter 5. And then we do the 3-part check-in that I'll kind of let Jared attend to, and maybe he can explain how we would explain it to someone new, because there's even a process of what we do there as well.
Sure. I'll explain a little and then I'll just do it.
Yeah.
And then that can be clearer. The 3-part check-in, like I said, is including the kind of frequency and vocalizing of the physical experience, the emotional experience, and the mental experience. So like right now, if I tune in and we'll stop and everyone will go around like this and someone will start. If I tune into my body, I feel a tightness in my chest, of a gentle excitement, or like I can feel almost the streaming of my veins. And it's kind of energy moving up and down my legs. And what I'll not do, just so you know, is I won't tell the story as to why. I won't get into story. So I feel my legs and the energy in my legs, and then my emotions. I feel kind of like an activation in my heart, like a kind of where sadness is not overwhelming, but kind of deep. And my thoughts are activated or curious about this process, interested, like in the dialogue, and kind of, yeah.
So what really struck me is Lindsey talking about setting the tone and the atmosphere, and then setting the tone of presence without explaining why, just to say, this is where I'm at, right? In this given moment. And so I'm here. I don't have to do any explaining, right? I'm just checking in with where I'm at this moment. And so I'm thinking people are there and they're really getting help. What does the help process look like? You've mentioned before about not excluding anything. So everything is present in this experience and sort of invites different reactions and triggers and so forth. What does it look like from your guys' seat?
I don't know. The word I think is interesting. Like, I think that that's important, as we're so interested in our clients. We're not only do we have a deep longing to help, like really desire, like we're really here to help people. And I think that's really important. We're not just collecting paychecks. And as we like continue to rebuild our team, that's an important value of people that we bring on, is really, if you want to come in, like you really want to do the work, because it can be tough work. And I think, yeah, the other piece is we're also just deeply interested in our clients. They're fascinating. We're fascinated by the work. Group is interesting. I mean, for me, as long as Jared's there, otherwise I get nervous. And, but it's just really interesting. So I think when we bring that presence, it's not just about caring, but interest. I think that's a really important recipe to help people.
So if I'm new in the field, Lindsey, and somebody's sort of listening to this for the first, like they're just starting a master's degree or some sort of specialized training in group, what unfolds in terms of being the treaters, the providers? What unfolds after you bring people and you invite them into the fold of presence, like you're talking about? What unfolds in a group, and how does it lend to effective help? What are you noticing, Lindsey?
Well, I think there's a piece. Let me think about this. So I think that when we bring interest and presence, it creates space for our clients to bring interest and presence. And we have the unique opportunity that, versus other facilities I've worked at, or, where I worked with people that have been in treatment 6, 7, 8 times, where you're really trying to engage them and not bring them the same material. Most of our clients here, it's their first time in treatment, and some of them the first time in therapy. So it actually makes our job easier because they're here because they want to be, and they've also never been exposed to what we're doing. So there's a novelty that creates sustained interest on their part that I think is important. And I think one of the things too that's effective and helpful and that we're seeing work is that we are dynamic. And kind of what I mean by that is that we switch things up a lot. So like we're in a 3-hour Zoom group 3 nights a week with our clients. So that could, for some people, be like, oh my God. So we just switched how we do group because of that. But the other piece is that we are always, because we're interested, that means that we're bringing dynamic material. We're also tuning into the group's energy field, which can sound woo-woo, but it's actually possible. Just like you can feel someone's feelings across a Zoom screen, you can feel the field of the group, and we can attune or do our best to attune to what do they need, right? Do they need a walk tonight? Self-care? Do they need XYZ? So when we're there, we're hyper present to the nuance of what's occurring, even in the meta communication that I think is really possible to experience in a virtual capacity. So I think that some of their colleagues that I've talked to, there's maybe some hesitancy with virtual care because they're afraid they won't have that in-person connection. But I feel like it's so possible to have that same experience virtually. I really believe in it.
So this whole theme of curiosity and of taking an interest. So if I'm in your group and I'm, newer, and you see me fidgeting and you see me like trying to reach for my phone, right? And just like, what's next? And I look, I'm distractible. I'm not like, I'm looking around. and I bring a sense of nervousness and fidgety, right? What would the curious provider do, Jared?
I think the fun part, you name how you feel in relationship to that person and that behavior. And so it's not confrontational, it's inclusive. So if you're fidgety, I'd be like, when I tune in with you, Adam, I feel this like anxiety in the top of my gut. And then I'll get curious. I'm like, do you feel anxious, or what do you feel? And so in terms of, instead of them being in like a fishbowl where a counselor is looking at them, trying to observe their behavior objectively, I'm subjecting myself to I'm keeping myself in the process. So I'm going, hey, I'm here with you. And what's happening with you? Does that make sense?
Totally. So I'm in there and there are, however many people are in the group with me. And I say, I'm so nervous. It's so hard to be here. I got so much to do. I've got a job and I have to sit here for 3 hours. It's a long time. And when's the break? And I have to go and do work afterwards. Right. And I bring that, right? How does that, and we call this treatment, by the way, right? Remember, we're calling this the effective treatment. So I'm bringing my nervousness and I'm telling you about it. What unfolds? What can you see unfolding in I'm sure you've had situations like what could you see unfolding in terms of how it helps reduce and address the issue of anxiety, for example?
Right. What's interesting is it doesn't well, I think it does reduce, but that can't be your goal, is to reduce anxiety, but rather to bring awareness to that there's an anxious experience happening. And I think one of the things about presence is that it's non-imposing. It's not pushing someone to do something different. I mean, good luck, right? You can't push somebody to feel differently. And that's encouraging them to kind of disassociate. So what we do is create a space and then hopefully create more space in the group to where the group, and you'll see this in our groups, like more senior students have more capacity to be present for someone who's coming in with this kind of intensity. And so we create more presence around a person's experience, and that can feel more like an invitation rather than a change. And of course, yeah, so I'll leave it there.
So what I hear in that is it's not a, hey, this is what you do, you should breathe, you should, start reading a cognitive psychology book. It's more about, I'm going to help raise your awareness, right? Through creating present moment experience. And you will learn right? And this is, to me, it sounds almost humanistic. I will help facilitate the environment, right? And you will learn through that experience and become more aware of your own experience. And in that awareness, you'll learn a lot. What do you think, Lindsey?
Yeah, I think we also have or not, or you won't learn a lot. Like that's included too, right? So like there's how do I explain it? Like this removal of ego, like from it, right? So it's like, I'm not trying to change you. We're not trying to reduce this, improve that. Like Jared's speaking to, it's like when there's, I think, an invitation for presence, and really what we're talking about too is like another word maybe is embodiment. And there's an invitation for gentle, slow embodiment. Because one of the things that we don't want to do with clients that are just coming in from using, right? We work with, addicts, alcoholics, or people with severe depression, is get them into their bodies too fast, right? Because what we see with this population is I can't be present for me. I can't be present for my life. I can't do this. So if you get them into their body, another way of saying that they're experienced too fast, right? They might relapse, they might self-harm. And so we're really attending to this gentle, slow approach to slowly stepping into their own feet as they move forward in their life. And there's also, I think, what Jared does, which is he's so good with language and so it's great. But he talks about clients having wisdom, right? And the way that I was brought up in therapy is no, the addict has no wisdom. They better tell them what they need to do because they don't know what they're doing, right? There's this other approach that Jared takes, which is they're trusting in the wisdom of the client. And not in a way that we aren't direct and we don't name things, right? Because there can be that trap too of oh, we won't give them feedback so that they'll keep on a path that maybe isn't serving them, they're asking for help for. But really trusting, even if they have a defense mechanism coming forward, that there's a wisdom in that, right? There's an intelligence in that. And so bringing this gentle care and positivity to all that they're doing, I think is really effective. And the word gentle is important. So we're incredibly direct with our clients. So there's no escaping what's happening, so that there's a directness with conscious care. I think that is important.
I'm listening and learning. So I just want you to know my pauses are about, I'm really digesting what you're saying and thinking of the importance of the atmosphere, the importance of being on the same page as your co-facilitator, the importance of knowing the strategy of how you want to create presence and address, Jared used the word escape, right? Address, this is not a place where we escape, but we gently address the present moment. And also that in that present moment experience, there's a dignity that you provide your clients with that says that I trust in your experience. I trust in the wisdom of your experience. It's humanistic. It believes that present moment awareness that you have, and you use the word capacity. I trust that I don't have to be the lecturer, teacher, coming from my hilltop, giving you, patient, client, all the wisdom that you inherently have it. You have your own. You have it. It's there. You have capacity, provided the environment allows for it. And I was thinking as you were talking, if you think about cases that you've had that just watching somebody in the beginning and watching their growth through this process, what they came what they were like in the beginning and what happened as they moved through weeks of this experience or months of this experience. Can you think of any examples that just wow, that's so cool to watch that you can share with us?
Yeah, I'm trying to think. Look, I have a lot, and I'm ooh, how do I do it that isn't making it so obvious to the client?
You could speak pretty generically.
Even an example being let me see how to change the story a little bit. But having a client get so excited and be oh my gosh, I was going to text you this weekend, but I didn't want to bother you, but I was working in the yard and I noticed I was thirsty. And that can feel like something so small. You can dismiss it. Oh, that's nothing. When you think of maybe where this client came from, literally couldn't attend to any part of their present, food, couldn't attend to like how they were feeling, anything, to have that subtle noticing of, oh my gosh, I was thirsty. I would have never noticed that. And accrediting it to that 3-part check-in we do without story. That's so important, without story, right? Because the story is an escape from the present. That's why we don't do it in the beginning, but we leave room for it at another point in the group. But that was like a huge victory. And so I think that is like an example of like, holy cow. And then of course, so much recovery in terms of their own like goals and why they came here, and seeing 100% transformation, and clients identifying, I've transformed. And I'm having a hard time without being too specific, but really we're getting feedback from our clients, and not only we're witnessing something, but they're able to notice, wow, like I'm so different, right? Mm-hmm. And I think the other thing too that we're not touching on yet, but that, and you can't tell on this as we're discussing, but we bring a ton of humor to group. We bring a ton of our personality and a ton of humor. And I think that's so essential for healing, is laughter. And so that's also just something that's naturally weaved in, is a lightness. Like this is serious, right? People are dying, people are losing their jobs, people have all these things going on because of their addictions and their mental health challenges. And we bring a lightness as well that I think is essential.
That is, I love the idea of something seemingly so small, like I'm thirsty, showing a sense of being connected when the people who come in that I work with are so, one of our mentors uses the word dis-ease, not disease, but dis-ease, so disconnected, and that sense of I'm present and being connected to something I would never even be able to label as this symbolically showing growth. I totally get that. Jared, what's the type of situation in groups that you've done, and even historically, that just, just like, wow, they came in one way and to see growth. What's that like for you? What have you noticed?
The first thing that comes to mind is and I'll be careful how I say it, but clients, I've heard clients say the reason why they drink, and I love this, say drinking, the reason why they drink or use, and to leave space for, and this is going to sound funny, maybe not, but to first leave space for what problem is drinking solving for you? Like, what is it actually? What is the hand reaching for? Not just for the bottle, but behind the bottle. And you'll often find, I'll often find that there's a relational trauma or issue happening that can't get solved without the drink. And it can be something as simple as learning how to say no, right? If you don't have a no in your body, like no to that, and you're in a dynamic where you're constantly bombarded with someone else's energy and there's not a no, drinking becomes a necessity to deal with the anxiety or the overwhelm. And so watching, and again, like if we were to pressurize it and you realize, oh, you're drinking because you don't know how to say no, well, we're going to just try and get you to say no. It's like, no. but watching the process, I'm thinking of multiple clients in this kind of example of them tending to both their sobriety, feeling the K's or the feelings that don't feel good, so leaving space for that when the drink goes away, and then having this is where their natural energy, when it's given just a little bit of support, encouragement, and education, and Lindsey's so good at education around relational health, they get to start to tend to relationships in a new way that most likely their psychology never learned. So they were growing up almost limping psychologically without knowing. And so getting to watch someone, and it definitely takes some time. We find success, 3 months would be really. It's usually 6 to 7 to 8 months. And then they're in this new phase where they get the memo, like, I have to tend to my relation and the kind of shadowy aspects of that in a new, consistent way. And the need to drink starts to decrease, and you see sobriety happen. And so I'm thinking of multiple people. That's where it's like, oh, this is so exciting because they get to be in relationship, which I think is the subtext of a lot of addiction. I was traumatized by relation, or I don't have the education on how to be honestly and openly in relation. That's
Yeah, I do a lot of groups myself, and I so can I know what you're talking about when you watch the that awareness and the ability to not use that drink as a reflex, but to develop an awareness of how I am in relationships, and just that simple word no, right? You think about it, just sounds so easy. Just tell them to say no. It's so not like that, right? Just say no is so shallow, and being part of the experience where you're helping people to recognize and bring into an awareness that the impact of others on them, and that word no as being an essential part of changing the trajectory of their life and not drinking is so powerful. I want to know, I know we're just in moving on time. I want to just really bring home one thing, right? Which really was hard for me. And I want to take a little bit of time to hear how you both addressed it. Here, Lindsey, you're tasked with building this program. You get this beautiful space. Everything is going and the engine's working. You know, you have set up the group room perfectly, right? You're doing all these things to create the atmosphere. It's really important to you. And all of a sudden there's a pandemic. And okay, now this thing that is so personal and so about being in a room and everybody together, all of a sudden you pivot and you're tasked with doing everything you've been doing on a computer screen or on a phone, right? So, and it's almost like you're talking about it like it was seamless, right? How did you do it? Right? And I'm watching a lot of people, I speak to a lot of people in the field and they're really, really having a hard time with this. So what did you guys learn? What was it like? Was there a lot of stumbling and fumbling before you got there? And where are you at with it?
Yeah, I think, and then Jared, I know will have some great input, but I think the first thing is like anytime there's a crisis, like flexibility is key. And Adam knows that like flexibility, I love boxes. And so like flexibility isn't always my reflex, but in a crisis, so like being willing to change, adjust, pivot, throw things out that might have worked before, they're not going to work anymore. And so I think one of the things that we did is we changed our clinical structure immediately. Like we changed where before we had a lot of variety in providers so that clients wouldn't get burnout. So in-person variety was what we valued in terms of clinical care, where when we went to virtual, consistency was the value. So so then we switched it to Jared and I carrying the caseload. That means each of us met with our clients individually, and then we co-facilitate the groups so that the clients could always expect the same thing every time, as opposed to before. It's like the atmosphere of the facility created that containment and consistency. And so we brought variety in through providers. So one of the things that we want to ensure, right, is that the clients don't get bored and get the same information from the same people. And that's essential, I think, with virtual care is just consistency. And so where we bring variety is not through providers now, it's through content and process in the group. And I know, Jared, you might have more to add.
Yeah. So in a funny way, it's a microcosm of what the clients are coming in with. They're coming in with an externalized experience of almost trauma or overwhelm, where what you were doing before doesn't work. And what happened at Sunstone to me was a moment of like, oh no, like things are falling apart. Or this is actually a moment of crisis where it's like where we have to slow down, take stock, and move with it. And I think I'll say this is what to me is sort of funny, and hopefully Lindsey, this is okay. Lindsey was like a gold mine of capacity. And I know that you're not going to run groups forever, but you had such a capacity, and you weren't running groups. You were like holding the whole business. And so what it essentially did, the crisis, while it really hurt things in a way, it came in, and to me, it clarified the, it clarified the trajectory and the vision of the company. And two, it helped, I think, us as a company, like, use the assets that were there and that we hadn't seen. And I think specifically with you, Lindsey, like, it really brought the consistency, like you said, of our dynamic in groups. And it brought this new thing was born. And I like how you said flexibility. Instead of us trying to make it fit an old model, the old model was not there because it wouldn't reach in the COVID time. So we're in COVID. That's what's here. We have to change and adapt.
So you talked earlier, the both of you talked about curiosity, presence, escape, gentle reflection, subjective experience of the provider, all of these things that create an atmosphere that allows someone to be present and really get to learn about themselves and others in a different way, right? So in the Zoom or in the telehealth world, right, do you find that it's very different, that because the goals are the same, meaning if I saw you both doing in-person work and you went back to pre-COVID days, right, is it very different, or is the mission the same and it's just technologically, it's the only difference is technology?
I mean, I have a lot. Go ahead, Lindsey.
No, please.
Well, yes and no. Like in a way, and this is specific. Like, this is Lindsey's vision coming in, and I think starting a company. I don't even know what that's like because I'm not in your shoes, Lindsey. But Lindsey was wearing so many hats, and I think that what I was trying to say before with the times, the stress of the times, it like clarified, like, okay, well, we got to do this now. And so yes and no to your question, Adam. Was it way different? No. But to me, what happened after COVID is we got very focused on what is it we're bringing, how are we going to do it through this medium? And a lot of it was like, one, accepting that this is how it was, and then two, moving from that reality and really filling it in. And this is a longer story, but to shorten it, with Lindsey's vision. This is, to me, what Sunstone is, and I think any organization out there, from leadership down, the leadership and the kind of is holding the container and filling it with their vision. And so really what we're doing effectively, and my job too, is a kind of liaison to her vision. And what's cool about Lindsey is when she says flexibility, that's what's true. So she includes, so if I have a genius, not genius, but like everyone has a genius, a capacity inborn with them, she doesn't exclude that. She's like, we got to use this because this is what Jared shows up with. And so she and her vision includes what's there. And so COVID, I think, helped clarify that.
Very cool. And Lindsey, just to give us a sense of what that looks like on a specific level in terms of all of a sudden being a provider of your everybody's on screen, right? What does it look like specifically? How did you continue to pursue the mission when everybody's looking at you on a screen?
I think it comes from a deep belief that this is highly effective. So there's no part of my biology that doesn't believe in virtual care. It's so effective that I have no desire to go back to in-person for our intensive outpatient program, right? In my private practice, someone wants to come in, great. This is so effective in my experience that it would be clinically contraindicated to go back to in-person with this population. That's how much I believe in virtual care being effective. So it's been something I never would have considered pre-COVID ever. I never would have thought, oh, let's do 3 hours a night with clients. That sounds great. No, I would have been like that. They'll want to ATA all of them at once. No, we have clients that the way that we know that it's effective, besides just our personal experience and experiencing the clients and seeing their transformations, is that clients are staying in care longer, right? When we were in person, maybe they'd stay 2.5 months. We have now clients that have been in program with us over 6 months, right? So there's something that's happening, and it's not just, oh, it's convenient. There's something I think that happens when someone's in the safety of their home, that there's a dedicated presence to what's happening. Like there's safety, and they can, go check on their kids or like go get something. It's so great, and it's not lost. There's no subtlety lost in terms of the connection with the clients. We don't lose attending to their feelings. We don't lose their energy field virtually. But I think that's competency.
In short, Lindsey, from a theory standpoint, how on earth do you keep that alive? I feel your belief. I so hear it, right? What do you account for the ability to have that success in a telehealth space?
Jared, you want to take it?
Yeah, think of like kombucha. Kombucha, like you create they call it the mother, and that's inoculating it with healthy, good bacteria. The group is just like that. You're creating a container, and the clients fill it with their energy, and you create health. And so people, when they come to group, it's like your job as the facilitator is to create the health of the container, and that container starts creating its own gravity, and it serves for in a very deep, almost mythological, old school human way. It creates the community that sees you deeply in your transition. And so how people keep coming back is they feel seen. And when there's no price tag on that. Like when you feel like, one, you're going in because you're in the middle of shame with your family and having all of this difficulty from your addiction or mental health issue, you come in, and instead of it being like I just got to stop doing something and fuck up, it's no, I get to be seen even more deeply in my process.
Even digitally. So the community, everything you're describing could be translated digitally. Is that the right word, digital? Yeah, I think so. Virtually. Yeah, thank you. So it can be that experience that you're excited to talk about, Jared. It could be captured just as much in a virtual way, which is cool. So in ending, I want to thank you both. This is a great way for me to celebrate my day and to hear and really get me thinking about what would it look like to improve on my own skill set here. And just for the audience, how would we reach Sunstone? What's the best way for anybody to reach out if they have any questions or providers have questions?
I think the best way is for our website. So it's www.sunstonerecovery.com. And then we have a couple ways that you can reach out via email from our website. So I think that's the best way.
I just want to really say again, thank you. It's so obvious how invested you both are in this, and how excited you are about it, and it's contagious. So now I'm thinking. So I hope you both have a great day, and thanks for joining me in this discussion.
Thanks, Adam.
Thanks, Lindsey. Thanks, Jared.
Take care.
This podcast is for general information and entertainment purposes only. This should not be considered treatment advice, nor is it a substitute for an individual treatment plan. If you have questions or concerns about your individual situation, it is strongly recommended you consult a licensed professional to talk about things that are specific to you. If there is an emergency, it is strongly recommended you seek treatment at your nearest emergency room.